Okay.
Oh, hold on. It's being recorded.
Just let it record.
I just hit continue. Um, yeah, what did you want to know?
I mean, just like describe it and if you would have done anything differently, what you got out of advocating for yourself. Or,
I
well,
got
what
I got a fantastic oncologist out of advocating for myself.
or what
So,
you got out of dad advocating for you.
well, when I needed dad the most to step in
Well,
that
and dad can
gap,
also talk.
right. Um, he was out of the room.
Is he here?
Now he's here. Oh, Emil was asking me about the need of an advocate, or self-advocacy, or someone that helped me when I was going through cancer treatments. But I think the key thing is, um, so when I needed dad was when I was having um, panic, where I wasn't thinking clearly, couldn't make decisions because I was basically in anxiety mode, um, or was so sick that I couldn't easily say what I needed. But dad knew me and knew that what he was saying wasn't normal. And then he would step up and say, "We need this," or "We need you to do this, you know.
Yeah,
Yeah.
that's why I always tell people to write down what they need so that if they're having anxiety, they can fall back on the paper.
Yeah,
Or
that's
like if
because,
they're too sick to speak, they can show the doctor the paper.
right. The only thing is when you're so sick, you couldn't write it before and you're having like an acute
Well,
problem.
that's that's the point. You have to write it before when you
Right.
feel good.
Write it when you're well.
Right. But what I'm talking about is when you have something unexpected and acute happen
Yeah.
where you don't know what you need, you just know something's wrong, and you have to go try to go to emergency or go to the doctor, get help, try to tell
Yeah.
somebody over the damn phone what you need.
But I mean, for chronic illness, it is all different. Usually we have a range of symptoms. And so we can tell people like what our normal is and what is like an emergency.
Yes.
So, I mean, is there anything that you would change about how he had to advocate for you?
Yeah. Your dad was perfect and he knew right when to step in. And
And would you say that he had a lot of clear and communication?
absolutely, yeah. Because it
Because
gets
that's
to
a
a
big
point
section
where
here.
that's that gets to a point where it's very simple. This is what's wrong. This is what we need. It needs to happen now. You know, what are we waiting for? Why is this not happening? You know, need communication and action. Your dad was very good about breaking it down to those, down where it was clear and concise, and they knew they better get their act together.
Yeah. Okay, so I'm probably gonna start now. So this is self-advocacy for disabled patients by Community Medical Solutions.
Do we mute?
About me. Yeah. Are you okay? My need for self-advocacy. 99% of the doctors I see don't want to treat me or don't acknowledge my condition exists or say my condition is too complex for treatment, even though I know that that's wrong. This means I constantly need to advocate for decent treatment, respect and competency. My use of self-advocacy. Advocate for my health goals. Every time I set foot into a doctor's office, I have to. Otherwise, I get misdiagnosed and mistreated. It's very tiring. So self-care is an essential part of it afterwards. But practice also makes it less tiresome. My advocacy has led me to get diagnosed and treated while I started with doctors who said EDS was fake and didn't need any treatment. Oh, so I'm turning on subtitles. Okay. Here is a quote that says, much like love, advocacy is an action word. What is self-advocacy? Advocating for your health goals when your doctor is apathetic, standing up against mistreatment, invalidation, and disrespect from medical providers, knowing your rights and being vocal about them when they're being infringed upon, building self-respect and understanding the negative impacts of lacking self-respect, utilizing assertive communication and minimizing passive communication, practicing protecting your boundaries from strangers and creating specific action items for creating a list of social, professional, and informational resources, insisting on simple care others receive regardless of recognized identity, practicing self-care after advocating for yourself. Here's a graphic that says what is self-advocacy. Speaking up for yourself, learn how to get information, finding out who will support you, know your rights and responsibilities, problem solving, reaching out to others when you need help, learning about self-determination. Where may you need to advocate for yourself? With your general practitioner or primary care physician, with specialists, with insurance, in the hospital, in the pharmacy, at school or work. And there's graphic of a patient and a doctor in the hospital. Who needs an advocate? Everybody needs an advocate at one point or another, but some need it more than others, such as people with rare diseases, people with invisible conditions, young disabled people, people with permanent and chronic health issues, people with health issues, and a marginalized identity. Advocacy area self-questionnaire. Ask yourself these questions to determine what areas of self-advocacy you need to work on most. You can contact me for a personalized plan. Some of the key questions to ask are, I let medical providers invalidate my diagnosis. I don't fight for treatments I've been recommended. I let others question my diagnosis when it's not recommended. I stay with unsupported providers. I don't know my rights in the medical setting, public sphere, and workplace. If my health goals aren't supported, I stop pursuing them. As well as, I don't feel deserving of the same level of medical care others deserve. I procrastinate getting the help I need, or wait until an emergency to speak up for myself. I don't know what I need to do to reach my health goals. I let people in power disrespect me. People often call me hysterical when I express my symptoms and needs. I don't have health goals. I don't know how to utilize professional support for my health goals. Communication is key to being an advocate for yourself. Learn the difference between passive communication and assertive communication, and Reduce the amount of times you passively communicate. Passive communication is letting others control the conversation, even when it's about you. Passive communicators often lack respect for themselves, an opinion, feelings, and desire. Passive communication places one's needs above and desires below those of others. Conflict that can be creative by passive behavior can lead to stress, resentment, anger, feelings of victimization, and a desire for revenge. With assertive communication, you use actions and words to express your boundaries in a calm manner with an air of confidence. Being assertive shows that you respect yourself because you're willing to stand up for your interests and express your thoughts and feelings. Both what you say and how you say it, diplomatic and calm. Here's the assertive communication is best for self-advocacy. Here's a quiz. Passive or assertive communication. You can unmute yourself for this. Places the opinions of others above their own. Has confidence and self-respect. Protect.
Oh, so are you supposed to say out of 1 through 7, which one's passive, which one's assertive?
Yeah.
Okay.
Conflict.
So can we go through them one at a time instead of going down the whole list?
You're breaking up, Emil.
You weren't saying anything. So I was just continuing.
Oh, okay.
Or should we
Okay,
go
how about
yes, no?
Hold on.
no, it's passive or assertive.
Okay.
How about number 1?
It's passive. Can you give an example from your own experience of that?
People think I'm being lazy when I use my wheelchair, and so that would be me valuing the other person's opinion so much that I don't speak up to protect my self-respect.
Okay. And then in some cases, someone might try to not use their wheelchair, right? Even though they need it,
Yeah,
and then get hurt.
but this is specifically about what you say, not what you do.
Oh, okay. Okay.
So has confidence and self-respect,
Assertive.
Assertive.
protects boundaries,
Assertive.
poor boundaries,
Passive.
That's passive.
causes internal conflict.
Passive.
That's passive.
Yeah, because you're saying one thing that you don't really want, but
Uh-huh.
you want something else.
Right.
Empowers you through authenticity.
Assertive.
Assertive.
Yeah. Usually with people who have anxiety, low self-esteem, or trauma.
The passive voice.
Yeah. Things to remember. You're not high maintenance. Your needs are just different. When you get proper care, your overall level of maintenance decreases. When you do not receive care, your overall level of needs increase and you are seen as complex and too much. The reality is you have more needs than others because of medical neglect. For example, think of me when I came home in 2019. Think of me now that I have real treatment.
Right. Right. It's much less complex once you're treated and you break it down into parts that manage certain symptoms and comorbidities, et cetera, et cetera.
Yeah, and obviously once you're actually diagnosed, also you can mute yourself again. I'll tell you when you can unmute. Even if you needed long-term care, It was very intensive. It doesn't mean you don't deserve respect. These conditions are things you choose or can control, and people disrespecting you for things you can't control is at the core of ableism. You're not needy, high maintenance, or hysterical. You're expressing your needs and symptoms, and people are expressing their prejudices. So, because I was working with somebody who was a Black woman with a tumor and also psychosis. And so in this case, it was both sexism, racism, and ableism. And also, you should not have to deal with whatever you have. You should not have to live with these severe symptoms because they, quote, aren't that bad. This is people's ableism showing that they have little empathy and think that you should be able to put up with more pain than they would say to another group of people. Having psychosis, anxiety, or depression doesn't make your experience with physical disability invalid. It's important to know yourself so you can tell others what you want. Self-respect, understanding you deserve the same level of care as everybody else is essential. List 5 positive impacts of self-respect and 5 positive impacts of self-respect from people in power. List 5 negative impacts of lacking self-respect and 5 negative impacts of not getting respect from people in power. List 5 negative impacts of not being respected on your mental health in order of magnitude. You can unmute and we can all talk about this. So for me, having self-respect increases my self-confidence. It makes me feel worthy of love and care. It makes me feel like, I'm on the same level as everybody else, where I know that when I lack self-respect, I don't, I feel like I'm so different from everybody else that I'm not the same. And that mean, sometimes like I've even thought that I should be treated differently because so many people had told me that. And the 5 positive impacts of respect from people in power. Well, the major one that I can think of is that there are much better positive health outcomes. You also feel a lot more seen and heard and more validated. Things get done a lot more quickly. Like when we were at that neurologist office and he was not respecting me at all and only respected me when my mom was with me.
Yeah.
And it also just makes me, feel like I know that my diagnosis is real instead of doubting myself. Like when a lot of providers say that EDS is fake, it does make me question it a little. And then the impacts of lacking self-respect, more anxiety and depression and internalized ableism. And I don't feel like anybody would want to love me because I'm disabled. And I feel very like different and isolated from everybody else. And the negative impacts from not getting respect from people in power. Obviously, the biggest one is the health impacts, not getting diagnosed, not getting treated, getting turned away from hospitals. All of those have happened to me, as well as feeling very gaslit by professionals when they, even after I had my diagnosis, said that EDS doesn't exist or EDS is fake, or, like, oh, everybody who has EDS is just a hypochondriac or has Munchausen's. That doesn't make you feel good about yourself and it doesn't increase your self-respect. And then it also just makes things go a lot faster. And then the negative impacts on my mental health would be medical anxiety, um, anxiety about dating, feeling different and isolated from others, feeling like I'm a burden or too much, and feeling guilty for using mobility aids. Do you have any comments or questions?
I think, you know,
What?
Do you have any comments?
so yeah, I definitely think it's important for uh your um psychological well-being, because if you don't have self-respect, you don't um you're not you don't have your own self-worth. um so you don't do the things you need, get what you need. And I think you're more easily led by doctors. Oh, it's not that bad, just live with it. Or um you know
Or questioning your sanity because someone says something isn't real. And that's just bullshit.
yeah, and for myself, self-respect, it's I respect myself to value my not go along with the crowd, like um peer pressure, you know even from like family. Oh, we're all gonna go and meet at the wherever that restaurant was, celebrate birthday. You should come. It's like, well, no, not, and here's why. And if you uh, agree with me or not, I respect myself to know that that's not what I want to do.
And it wasn't because we didn't want to celebrate with Miranda. It was,
It was
the
COVID.
pandemic. Yeah.
Okay.
Oh,
Leaving you okay. Here, the dad came up.
we can't hear what you're saying.
I can hear mom, but dad is breaking.
Okay. Did you want me to repeat what I was saying?
Oh, and then it completely cut out. Okay. Can you hear me?
We can hear
Yes.
you now.
Okay. So you can mute yourself again. Health goals are important for many reasons. Short term, and it's also important to know the difference between short term and long term health goals. Short term health goals are 1 to 6 month goals, easily accomplished. A PCP can help you reach these goals. Minimum referrals are needed. Doctors don't have long wait times. You don't need to book in advance. There's no recovery time after treatment. For long term, it's 6 months to many years, more complex. There's specialists needed. More than one referral may be needed. Booking in advance may be necessary. More than one doctor needed to work together to accomplish this. And you may need to take into account recovery time after a surgery or procedure. Long and short term health goals. Questions to ask yourself. What specific activities and resources do I need to achieve my mental health goals or physical health goals? What professional and social support do I need for my long and short term goals? Prepare health goals before appointments so you have something to fall back on when stressed. Self advocate resolution. I want to volunteer work and be seen as a productive member of society. I want to spend leisure time with my friends and family and have fun. I want to be welcomed and have a place in community activities. I want to live as independently as I can and make my own decisions. I want access to a good education and opportunities for lifelong learning. What gives disabled people rights? The Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights, the International Covenant on Economic, Social, and Cultural Rights, the Inter-American Covenant on the Elimination of All Forms of Discrimination against Persons with Disabilities. Knowing your rights in public places, the rights of persons with disabilities include freedom of speech, respect, privacy, the right to both marriage and family, the right to education, the right to health, and access to public spaces. In the workplace, you have access to reasonable accommodations and no discrimination. You do not have to disclose your disability to your employer. Anti-discrimination, equality before the law. Laws in America prohibit discrimination against persons with disabilities in any education, workplaces, public program, private housing, or access to polling places. The rights of a service dog owner. All states except for Alabama, Alaska, Iowa, Maryland, Montana, and West Virginia um, have laws that protect assistance animals from criminal interference, theft, and assaults. Also, all of these laws apply to service dogs and service dogs in training, except for in Hawaii, Michigan, South Dakota, Washington, and Wyoming. There's also laws protecting disabled pedestrians, typically known as white cane laws, that appear in most states. About half the states offer licensing fee waivers and exemptions for service dogs. About half the states offer, oh, finally, more than half the states have laws that make it a crime to fraudulently represent that a person has the right to be accompanied by a service animal. So you can't have a fake service animal. Um, Barriers to entry in public spaces. Lack of curb cutouts, which is where the curb dips down to be the same level as the street. Poor sidewalk quality, construction blocking off an accessible route, lack of training of drivers to use wheelchair lifts and buses, elevators broken due to poor maintenance in the subway, trash or homeless people's tents in larger cities blocking the way, steps to enter and no ramp, no accessible parking, too narrow of corridors for a wheelchair to fit through, and no handrails. So this here is a map of how accessible the streets are in DC, specifically sidewalk obstructions. So it ranges from blue being a low level obstruction to red being a high obstruction, with peach being a medium obstruction. Just look at all the red in the map. You can unmute for comments.
I saw the map earlier. Your graphics dropped off. It's just a little person icon now.
Oh, fuck. Wait, so sorry. I wanted. So after I just wanted to go back so that everybody could see everything from after the call dropped off. So this is the self-advocate resolution. It gives disabled people rights. And a bit of time on each side, people could read it.
Yeah, your audio is now a little breaking up.
Can you hear me now?
Yeah,
Also, are there still subtitles?
yes.
Uh, so far, do you have any questions?
No, it's talking that DC map with the inaccessible areas, accessible areas.
Yeah, it's just after. Just want to see the slides as well.
Oh, your audio's picking up a little bit now.
I just want to make sure that people can see the slides.
Okay, I can hear you now.
Here is the map. So blue is low obstruction, peach is medium, and red is severe. Oh, damn it. Tell me if you have any questions or comments. Comments?
That all that red, the center, is that around the main, like where all the monuments and stuff are?
Yeah.
Oh,
Sorry, what?
I said that's shocking. You would think that they would at least make the capital completely accessible.
Yeah, it's not that shocking if you're disabled and live like this, but yeah. So access to what?
Able-bodied people
No, I
don't
know. If
think
you're
about it.
able-bodied, you have no idea because you can get around everywhere without having to plan extensively.
Right.
And usually there's like only one or two routes that are fully accessible. And if that's closed off for construction, you're completely screwed.
Damn.
So access to employment. Workers with disabilities are less likely to receive promotions as able-bodied workers. Additional studies have demonstrated that persons with disabilities in America who do find jobs earn less than their coworkers without disabilities. And in the bottom, there's a graphic where there's multiple people, and above the able-bodied people, there's a green check mark, and above the disabled people, there's a red X to kind of show what goes through the minds of, people who are hiring. And this is a graph on disability discrimination, on the cases of disability discrimination in the workplace. So it says hiring, promoting, giving tasks, or inviting certain able groups to company events, making offensive jokes, giving tasks that cannot reasonably be completed, making your work environment impossible to navigate with a disability are all forms of discrimination. So it went down between 1997 and 2001. And from 2001 to 2009, it went up. And from 2009 to 2019, it went up to almost 25,000 cases of disability discrimination just in the workplace alone. Access to education. Students with disabilities were also less likely to graduate from high school. A scant 12.5% of students with disabilities in America have a bachelor's degree, compared to the national average of 30.3. A number of the colleges in this nation still do not have adequate support services or even awareness of disability issues, and remain inconsistent in their interpretations of their requirements in regards of to the accommodations of persons with disabilities. Many students with disabilities are forced to pay for the extra costs of their accommodations and may need additional time in order to graduate, something that increases their overall financial cost related to the education, as well as the fact that private institutions don't have to be accessible at all. And here is a map of the accessibility at Berkeley. So there are 5 main spots where Berkeley is not accessible, that has only stairs, or that the path is too steep, that there are, just a lot of very steep paths and stairs, or very poor sidewalks that need renovating. Or, sorry, 6 places. Access to healthcare. A study performed in the state of California found that 22% of persons with disabilities experience difficulties with accessing healthcare facilities. The study also found that 12.9% of disabled people reported unfair treatment by their healthcare providers due to the disability they experience. People with rare diseases face even more challenges. 76% of patients said lack of information prevented them from getting a diagnosis. And the average time to get a correct diagnosis is 8 years. But for 19% of, sorry, that's supposed to be 10, but for 10% of people, it's over 10 years. 39% of rare disease patients said they paid for ineffective treatments, and 95% of rare diseases do not have any FDA-approved treatments. On average, people get 2 to 3 misdiagnoses before getting the correct one. Yeah, so it can take a patient, depending on the study, anywhere from 4.2 to 8 years to get the correct diagnosis. And It takes 7.6 years for the average patient to get diagnosed. It takes 8 physicians and 2 to 3 misdiagnoses. Only 45% of patients have cost covered insurance, and less than 50% of patients suspected for a disease received a satisfactory diagnosis. According to ADA guidelines, laws in America require employers, schools, landlords, as well as the government to make services accessible to people with disabilities through the provision of reasonable accommodations and modification. But in America, reasonable accommodations are cheap accommodations. Can you hear me all right?
Yes, perfectly.
So this is a graphic about accessibility. 52% of schools are not wheelchair accessible. 61% of government websites are not accessible. 79% of disabled people face difficulties evacuating in a natural disaster. And many countries have no or like less than 50% guidelines for accessibility. Accessibility and reality. Accessibility is the primary component in the fight against discrimination involving persons with disabilities. The Department of Transportation states that only 55 to 60% of public buses have wheelchair lifts. Even the buses that do have the lifts find that persons with disabilities are being denied access due to the lifts not working properly or bus drivers not having proper training to work them. Persons with disabilities in America are also commonly denied requests they make for reasonable accommodations or modifications they need related to housing and even education. Do you have any comments? Do you have any comments?
Go ahead, Greg.
Yeah, going back to the discrimination in the workplace. So it seems that it's been going up since 2001 to present. Is that attributed to anything, or is there any study of why that is?
I'm not sure. It might be
I mean, maybe are
that,
there more disabled people in the workplace and therefore
yeah, I mean, so
but I don't know.
basically, because of the healthcare system improving, there are more disabled people, but we're not super visible because accessibility hasn't improved a ton since the ADA. And so basically, some people think that because there are more disabled people overall, that there could be, some stigma that people like don't, maybe think that it's like contagious and don't want disabled people around, or just feel like, disabled people aren't good for society, so they're unhappy with them even existing.
Well, it could be too that the disabled community is finding its voice more and reporting it instead of
Yeah,
not being a self advocate, um,
definitely.
dealing with it and not reporting it.
Definitely. So here this is a diagram of transportation in the UK. 94% of buses were accessible, and only 25% of train stations or metro stations were accessible. And the increase of accessible trains in the past year was only 5%. So the year before, only 25 or 20% were accessible. And then accessible leisure. 72% of disabled adults have experienced at least one barrier when playing sports. Of disabled adults, or 68% of disabled adults have experienced at least one barrier visiting museums. 3/4 of disabled people have left a shop or business because of accessibility issues. Common inaccessibility barriers are narrow stairs, doors, and corridors, inadequate lifts or escalators, lack of ramps or handrails, and parking problems. Accessible employment. Disabled people are twice as likely to be unemployed as able people. Disabled people will need to apply for 60% more jobs than non-disabled people before they find work. 9 in 10 disabled people who are not in work are economically inactive. Are these laws for accessibility fulfilled? Millions of Americans with disabilities are deprived of their rights despite legal protections related to us due to lack of awareness, intersecting marginalized identity, and failure to provide us with reasonable accommodations in a number of areas. Persons with disabilities in this nation continue to face considerable levels of discrimination faced related to employment, services, education, and additional areas. When situations such as natural disasters occur, persons with disabilities are frequently denied our right to protection. A study on emergency management found a majority of the Federal Emergency Management Agency, or FEMA, emergency managers did not have the training to work with special needs populations to include persons who experience forms of mobility impairments or to accommodate for other forms of disability. Estimates demonstrate that around 73% of the fatalities related to Hurricane Katrina in New Orleans were persons over the age of 60, despite the fact that this population comprised a mere 15% of the overall population involved. Any comments? I think that that statistic is very shocking. Hello?
Sorry.
So it is shocking that the elderly and disabled is physically not able to mobilize and get out of the path and get out of danger.
Yeah.
That's a shocking number, and the 52% of schools is also a shocking number. So over half of schools are not accessible.
Is it primarily private universities?
No, I mean, it's both.
Okay.
So this is about the law and disability. When legal organizations are accommodating to disabled people, there's always a loss of life and liberty. Social service organizations in America are many times unprepared to address the needs of persons with disabilities. For example, sheltered for battered women commonly lack staff members who have the training needed to work with the unique needs of women with disabilities. Police officers and other law enforcement officials only receive minimal amounts of training related to accommodations. And also, it's not guaranteed that you can even have your wheelchair with you if you're in prison. Self-advocacy is an important life skill. Stress and anxiety management. So coping skills to use. Cope ahead, which is to imagine what you would do if what you're worrying about would actually happen. Doctor anxiety plan. Self-care during and before appointment. Bring fidget toy, headphones for meditation, or whatever else helps with anxiety. Have a mantra for medical stress you repeat in the doctor's office. Have everything you want to say written down so when it's hard to communicate, you have something to fall back on. Stress management. Break down goals into smaller steps. Practice self-care before, during, and after. Have social and professional support. Be very clear on what other people can help you with. Practice assertive communication with a trusted loved one. If scents calm you, bring your favorite essential oil. Keep the end goal in mind. The stress is worth good health. Standing up against invalidation. Having a rare diagnosis isn't an invitation to invalidation. Having a mental health diagnosis doesn't invalidate physical symptoms. Being a complex patient doesn't mean you deserve invalidation or disrespect. Having a marginalized identity isn't a good reason to be denied care. So, ways to practice. Role play with a loved one as doctor and patient with, what you'd say if a doctor invalidated you. Have pre-made statements that counter invalidation. Have mantras that you tell yourself after being invalidated. So I'm very interested. So I'm going to tell you some very common things that I hear from doctors, and you're going to say how you would stand up for yourself if you were a patient, okay?
Okay.
So one thing that I hear very, very often is that I'm too complex for medical care or any kind of treatment, and I just need to get used to the pain. What would you say?
Oh my heavens. I would say that first, I would probably question the doctor's credentials and ask him what experience he had these, dealing with these symptoms and in diagnosis of what's going on. And then, you know, you have a bad doctor if they get and don't,
Wait,
you
sorry.
know,
If they get what?
defensive,
Yeah.
because a good doctor is like that doctor that we saw when your knee was jacked up and we went to the ER and you asked them if they were familiar with ES. And he said, yeah, I've heard of it. And then when you asked him, what is it? He didn't get pissed. He actually answered you and had a good dialogue with you. And then you were able to proceed with confidence. And he knew where you were coming from. And you know, knew that he could care for you and had a good attitude. So, I mean, that was good for everybody.
Yeah. Well, and also it's like the pain, especially when it's chronic, it only gets harder to deal with, not easier. And so that's another big thing that I always say, and also it's like you would never tell somebody with like a broken leg to just deal with it. So why are you telling somebody with a chronic illness to just deal with it?
Right.
So how about a doctor saying, that your condition is fake or that you must just be a hypochondriac? Because these are all things that I've heard way more than once, probably even more than 5 times.
See, I think that goes back to questioning their credentials because when you have clear evidence of certain, uh, symptoms and they can even see it themselves, if they take the time to do some tests and they don't do that, then
Yeah,
that's
but what
okay.
if they're PCP and you need their referral to get the specialist you need to diagnose you.
What could you ask? Well, these symptoms are real. Is there a way to test for these symptoms? Like
Yeah.
Yeah.
for mobility, and and so let's proceed. And um,
And then you can see that I need a referral. But the thing is, you don't have to, so it is your
Yes,
right
I'm
to
not
get a
feeling very
referral.
good. I just have a headache now. Yeah, sorry. Sorry, what did you say?
I said, it is your right to get a referral. I never request a referral as in, could I please have this? It,
Well,
I
no,
get
but
this from
sometimes
you.
you need a referral and you can only get certain doctors through a referral. That's how
No,
insurance works.
No, I understand that. I'm not saying you're not getting the referral and going. I'm saying the PCP has no right to deny a referral to you. You are
But
their,
they can.
uh,
That's the thing. They're the person in power. They can do whatever the hell they want.
see, I disagree with they're the person in power, because as a customer, and they are I'm the customer, they are the supplier of the service. That means I'm
'Cause-
the one that is in charge here.
Okay,
I'm
because
the
it's not
one that
set up
calls
like
the
that.
shot. No, but the
Okay,
thing is, you
wait,
can
Mom.
that.
Mom, let me
Yeah.
explain it to you this way. Most of the time when you report, so first of all, it's super hard to actually get a suit for medical malpractice. Second of all, when you actually file a write-up for a doctor, they hardly ever get any negative consequences. Also, doctors are very unwilling to testify against another doctor for medical malpractice, as well as the fact that just like police, doctors also monitor their own internal structure. So doctors are the one, the hospital monitors their own hospital when it comes to malpractice, not an outside organization. So they have their best interests at heart, not the patient always. And so then you're in a position where the doctor is the sole person who can give you the referral. It's very hard for them to have any negative consequences, even if you write them up, or even if you try to sue for medical malpractice. And then also, they can literally, prescribe things, even withhold information so that you take a certain med that they want you to take so that your health is greatly impacted by what they do. That's what I mean when I say they are the person in power.
And that's why advocacy is so important. That's
Yeah.
why protecting the vulnerable and making sure that they're not the ones that call shots like they're a bunch of mob bosses or gangs is important. It's important for everybody, not just people that have chronic illness. Everybody in their life will at one time or another be vulnerable, whether it's you're young, you're infirm, you're elderly, you're pregnant, you're female, you're a marginalized individual because of your gender. I mean, it's important to all of us.
Yeah, definitely. Because also it's like if you go and just asking doctors about their credentials, like some just won't even answer.
That's when I always turn around and walk my ass out the door, but not everybody can do that.
Yeah,
And
because
that's
like also
hard.
sometimes it's super easy or urgent, not easy. Anyway.
Yeah.
So that says advocacy is an underrepresented form of love. So strengthening self-advocacy, role-playing with a trusted friend or family member, health goal worksheet, practice assertive communication, practice preserving self-respect, Make a self-care plan and stick to it. Have notes for all appointments, so when you have anxiety, you have something to fall back on. Bring something to your appointment that calms your stress and anxiety. Have clear action items for all health goals. Have a list of all available resources for you. So this is all about resource planning. List professional support you need for each specific goal. List social support you need for each specific goal and how you'll ask for help. List what you need from insurance, like a health coach, which is free, or hire a patient advocate, which helps you get the best health outcomes from your doctors. And then, so there's two sides of resource planning, social and medical. So for the medical side, what information do you need to accomplish your goals? What medical aids do you need? What medication or treatment do you need? What paperwork do you need to sign or have your doctor sign? What referrals do you need? Do you need authorization or pre-authorization from insurance? And then about the patient advocate. So patient advocates help support you with disease awareness and education. When you're seeing a doctor, help with a doctor and specialist directories, help you figure out treatment options, help with insurance, navigation, and financial assistance. And then they also assist physicians and disease center of excellences. So self-care is very important after appointments and also after you're advocating for yourself. There's many sides of self-care, such as physical and social, but for this, since usually appointments are boring and stressful, I chose relaxation and enjoyment. For relaxation, some options are deep breathing or meditation, nap or rest, have a hot shower or bath, progressive muscle relaxation, gentle exercise like yoga, art, a mindful walk outside, spending time with a pet. For enjoyment, journal, talk to a loved one, participate in a support group, practice gratitude, treat yourself with a small purchase that you would enjoy, turn to faith or find a deeper meaning, reflect on times you overcame another hardship, do a hobby that makes you happy, like baking, cooking, crafts, or gaming, reach out for support on social media. Self-advocacy gives you the skills and confidence to make choices in your life. This is my contact info. I go by Ellers Downless Events and my on Instagram and Reddit, and my Facebook is Fighting Ableism. And I also have a website that's at the bottom. And then my next event is tomorrow, not today, from 3 to 5 p.m. And it's Living with EDS and HSD Resources.